My name is Brent Smith. I am originally from Tennessee. I was born and raised in Memphis, Tennessee. And then I did my undergraduate training at the University of Tennessee in Knoxville. Went to medical school at the University of Tennessee Health Science Center in Memphis, Tennessee. After that, I did a radiology residency for 5 years at Mayo Clinic in Jacksonville, Florida. And then after that, I completed a year of fellowship and additional training in vascular and interventional radiology. An interventional radiologist differs from a diagnostic radiologist in that we have an additional year of training specifically for vascular and interventional radiology, where we primarily focus on image-guided medicine or image-guided procedures and techniques that can help patients. Diagnostic radiology is primarily where a physician who interprets imaging studies such as a CT or a CAT scan, MRI, which is also magnetic resonance imaging, plain radiographs where you get a chest x-ray or x-ray of your arm or your knee if it's bothering you. Also, diagnostic radiology will interpret ultrasound, nuclear medicine, and studies like that. There's a number of things that we can do for patients, whether it be from treating certain types of cancer, and that can be done either through an artery where you catheterize or stick a small tube in an artery and directly locate that cancer and inject chemotherapy right at the cancer, or making a very small incision and sticking a needle in through the skin directly into the tumor and using a heat method such as heat or cold to either burn or freeze the tumor. We can also drain abdominal abscesses or different fluid collections that need to be drained, whereas previously they might have to have surgery to do that. We can get access into the venous system, whether for chemotherapy or for somebody who's critically ill. We have various techniques to do that as well. We can do hemodialysis access, and patients who have a fistula or a graft in their arm where they're receiving hemodialysis, we can actually use that. If that becomes clotted or if that quits working, we can try different techniques to try to get that going again. You know, I chose interventional radiology primarily because I do enjoy spending time with patients and getting to know patients. Radiology doesn't have as much of a longitudinal care as an internal medicine physician or family medicine, just because patients will come in and get their procedure and then leave. However, with interventional radiology, I do have a little bit more time to spend with the patient, get to know them a little bit better. So I try to, I cherish that time and try to get to know them as best as possible. You know, my wife and I came from Florida in training and we loved it there. And we always decided we want to live close to the beach or close to the mountains. And we were recruited by HealthCare, and we came up and visited together and just kind of fell in love with the town and the people. Everybody is very nice. It's a beautiful area, and of course Blue Ridge Hospital, Grace Hospital, and Valdez are top-notch facilities, and the staff, whether it be the physicians, the ancillary staff, the nurses, the techs, and the administration, are all very accommodating and very friendly and seem to be to keep the patient in mind and make sure that the patient comes first. So that's very important.